Hello, my name is Kaya Naibi, and this is my literature review matrix. Homelessness poses a major community mental health challenge, placing millions of unhoused residents at severe risk from mental health, substance use, and physical health problems. Persons experiencing homelessness are more likely to have mental illness, substance use disorders, and various medical diseases, which are compounded for youth, as they have minimal experience navigating complex healthcare systems or limited knowledge of available benefits, subsidies, or services. Article 1. The inferred purpose of this study is to examine themes of teenage parenting and homelessness among Native Hawaiian youth. The study was guided by this question: how do Native Hawaiian youth experience teenage pregnancy and parenting while homeless? A critical interpretive phenomenology was used in this study to explore the lived experience of phenomena such as parenting and homelessness, typically within a group, such as Native Hawaiian youth. Limitations to the study. This study was conducted on a small sample size with a disproportionate ratio of men to women in a limited geographic area within Hawaii. Furthermore, inclusion criteria requirements made it difficult to find participants. The results of this study identified 3 themes, including lack of parental guidance, disengaging in the use of health programs and services, and the desire to become parents and to provide a better life for their child. Recommendations for further research. The sample could have been improved by conducting the study on a larger sample size, with an equal ratio of men to women experiencing homelessness and teen parenting amongst Native Hawaiian youth. Article 2. The inferred purpose of this study is to evaluate the mental health, substance use, and behavioral health treatment needs of unhoused individuals in Hawaii. Research questions integrated age, gender, education, marital status, depression, anxiety severity, alcohol use disorder, lifetime and current cigarette, cannabis, prescription opioids, heroin, and methamphetamine use. The type of study assessed representative community populations. The research team visited 162 participants at known community locations where unhoused individuals congregate. Limitations to the study. This study used a cross-sectional design, which restricted causal inference. Furthermore, non-probabilistic sampling limited generalizability to other rural populations. Study findings revealed a high prevalence of mental health and substance use problems. 60% of participants screened positive for major depressive disorder. 2/3 screened positive for alcohol use disorder. Illicit substance use was pervasive in the sample, with 7 in 10 participants using methamphetamines. Over 70% of the unhoused community sample were of Native Hawaiian heritage, despite Native Hawaiians composing just 13% of Hawaii County's total. The author recommends more longitudinal and qualitative research, as well as extensive community-based participatory research study to identify effective strategies to reduce high-risk behaviors of persons experiencing homelessness. Article 3. The stated purpose of this study is to evaluate the experiences of both the providers and clients of a street medicine program serving one side of the island of Oahu. An interview guide was used, including questions like, "Will you tell me the story about your engagement with the street medicine service?" and "Can you share with me the story about working for and with street medicine?" This study evaluates street medicine services provided to a specific area in Hawaii, which targeted homeless individuals. Limitations to the study. This study occurred over 3 months and utilized participants who were active clients of street medicine in one geographic area on Oahu. Results and conclusions. The story inquiry interviews yielded 6 primary themes, including substance use and mental health treatment, primary care engagement, managing chronic health conditions, lasting lifestyle changes, quality of life improvement, and barriers to success. The author recommends exploring perceptions and feedback from street medicine utilizers and non-utilizers from a larger sample size, from a larger geographic area who fit program criteria. The lives of persons experiencing homelessness are fraught with challenges. The findings of these studies suggest that unhoused individuals in Hawaii endure heavy burdens of depression and anxiety, unmet treatment needs, and poor health. Overall, the findings of these studies reveal a need for multi-system intervention, including culturally relevant and geographically contextual practices. References: